the MD Medic podcast. Guys, I'm sure that you've all seen the news about Demar Hamlin, the NFL player for the Buffalo Bills, that suffered a very devastating and unfortunate cardiac arrest while he was playing football against the Cincinnati Bengals. Our prayers, our thoughts are going out to him and his family. We wish nothing but a speedy recovery. We wish the very, very best for him and his family. It's a heart-touching situation, and I truly feel for him, his families, his teammates, all of them. Wish nothing but the best for them. So, that gets us into this podcast episode. What we hope to do today is dispel some of the uncertainty, some of the confusion about the situation of what's going on. What we're going to do in this episode is we're going to talk about different ways that someone who is healthy, young, athletic, can go into cardiac arrest while playing football. I was not there. I do not know exactly what happened, but I'm just using my experience and my knowledge as a critical care paramedic and as someone who is a student doctor in school to be an ER doctor right now to just analyze the situation and to help dispel some of the confusion about what's going on. So to start out with, we're going to define what cardiac arrest is, right? A lot of confusion is out there because people think that cardiac arrest is synonymous with a heart attack. That is not the case. What a heart attack is, also known as a myocardial infarction, it is basically where a blood clot or fat or cholesterol plaque blocks off your coronary arteries that feed the heart muscle of your heart. So essentially every cell in your body, including your muscles, your heart, your brain, need to receive oxygen and nutrients in order to function properly, and that is done through your blood. So your blood carries those oxygen and nutrients to all of your cells. So the heart, when it's not receiving that due to the coronary arteries being blocked off, coronary arteries like the left circumflex artery, the left main, the left anterior descending, the right coronary artery, all these different parts of the vasculature of your heart, when they get blocked off in an MI or a heart attack, then that is what's classically known as a heart attack. Cardiac arrest is when your heart stops. Cardiac means heart, arrest means stops. It is that simple. So when someone dies, their heart stops. It is not beating. It is not properly moving blood forward through the circulation as it should. So, heart attacks, which can be suffered after 20 years of smoking Newports and eating 50 pounds of bacon a day, those can certainly and very commonly and frequently do lead to cardiac arrest, but they're not the same thing. So if someone gets shot and they die, or if someone gets hit by a bus and they die, or if someone, as I said, smokes 20 years of Newports and eats 50 pounds of bacon a day and they die, all of them end up in cardiac arrest, which is the actual process of dying. And depending on the cause of cardiac arrest, in the first few minutes of the arrest, there is a chance to possibly bring them back from the arrest by correcting the heart rhythm. Very, very simple, very 10,000-foot view. But I hope that clarifies what cardiac arrest is, because I've heard a lot of people say that Demar Hamlin had a heart attack. That is not true. Demar Hamlin suffered from a cardiac arrest. Now, let's get a little bit further into what cardiac arrest is. So cardiac arrest can manifest itself as different heart rhythms. A lot of people are familiar with asystole, or the flat line that we all see on TV. It means your heart is no longer beating at all and no longer has any electrical activity. Mind you, every muscle in your body functions by electrical impulses firing and causing them to contract. So what EKG is it actually allows you to see the electrical activity of your heart that should normally, under normal circumstances, correlate with mechanical activity of your heart pumping. So asystole is one form of cardiac arrest. Another form would be ventricular fibrillation, also known as VF, also known as VFib. So, what happens with this is the bottom chambers of your heart, also known as the ventricles, the bottom chambers of your heart, which on the right side pumps blood to your lungs to get oxygenated through your pulmonary arteries. On the left side, pumps blood to the rest of your body through your aorta and through your different arteries. Simply put, what the ventricles are. In VF, what happens, these ventricles, instead of beating and pumping like they normally should, they just quiver. And it kind of looks like a squiggly snake on the monitor, right? This is absolutely a lethal rhythm. This causes cardiac arrest. This is cardiac arrest. And with VF, what we try to do very quickly is do CPR to do the work of the heart, which isn't working, Pumping on the chest pumps the blood around, which is what the heart's supposed to do. To get the blood to the brain, to oxygenate the brain, to keep the brain from dying while the patient's in cardiac arrest. And also, you shock ventricular fibrillation. You shock VFib with a defibrillator to hopefully correct the cardiac rhythm back into a normal rhythm. I just made it super simple. It's a little bit more complex than that, but that's the 10,000-foot view. Another cardiac arrest rhythm is ventricular tachycardia, also known as VT or VTAC. This is also a shockable rhythm that you want to shock in order to restore back to normal cardiac rhythm. What happens with this is the bottom of your heart only is beating super fast at like 200 to 300 beats per minute. And the top of your heart, also known as the atria, which dump blood into the bottom of your heart to be pumped out, they are not able to fill the bottom of the heart quick enough for the 200 to 300 beats per minute to actually move out through your body effectively, and therefore you are in cardiac arrest. This is also a rhythm that is shockable, that you need to shock promptly in order to get the patient out of cardiac arrest. So, the way that an EKG is set up is it shows the different phases of the heart's contraction cycle. I'm going to make it really simple. You see an EKG rhythm here, as you see pictured above me. What you're going to have is you're going to have the first little hill. It's going to be called your P wave. That's the top of your heart, your atria, what dumps blood into the bottom of your heart for pumping out. That's when that contracts. When your atria contract, you have the little P wave. When the big strong ventricles, the bottom of your heart, contract, you have the big QRS complex, the big spike that you see in the middle. And then after your ventricles pump, they recharge in the repolarization phase, also known as the T wave, right? Keep that in mind for some of the topics that we're going to discuss. Now, since you guys have a general understanding of what cardiac arrest is and the different rhythms that can cause cardiac arrest, we're going to get into one of the first possible causes of cardiac arrest during a football game that could have happened to Demar Hamlin. As I said, I was not there. I do not know what happened to this man. I am just giving some general possibilities of things that could happen, some theories, and explaining how those could be physically possible. Now, the one that everyone has heard of the most, the one that I've seen talked about on Twitter, on the news, on social media the most, is a event called Commotio cordis. Big words. I'm going to break it down for you, since everyone else thinks that they're an amateur cardiologist now because they know these two words, Commotio cordis. I'm going to tell you what they really mean. I'm going to try to break it down as simply as possible. Now, Commotio cordis is when a patient receives a strike to the precordial region of their chest. So the precordial region is right here in your chest. So you have your sternum, your breastbone in the middle. Right underneath that, and displayed slightly to the left, is where the ventricles of your heart sit. That's called your precordial region. If you're struck to that spot suddenly, swiftly, and with enough force, while on the T wave or the repolarization phase of the cardiac cycle, your heart can be put into ventricular fibrillation. So, in the phase where your heart is actually repolarizing, recharging for the next beat, it is vulnerable to get thrown off into a lethal arrhythmia. An arrhythmia is basically the heart's doing something it's not supposed to do. This interval where the heart is actually vulnerable to getting thrown into VF is called the QT interval. So, when a patient is struck swiftly and with enough force in the precordial region on a T wave, they can go into ventricular fibrillation and then go into cardiac arrest. This is possibly the case of what happened with Mr. Hamlin. He could have been hit in the chest hard enough during a tackle, could have been right on a T wave, it could have sent him into VF. One of the things that makes this possible and makes people consider it is the fact that oftentimes when people go into ventricular fibrillation, there's about a 10-second gap between the initial onset of the rhythm and the time that they go unconscious. This is because their brain is not receiving blood flow from their heart, and it takes about 10 seconds without oxygen, without blood flow to the brain to go unconscious. So, Mr. Hamlin was hit, and then he stood up, and then he arrested. He fell, went unconscious. That would be a very predictable pattern that you would expect to see in a situation of Commotio cordis. However, some of the things that make me consider that it is not Commotio cordis, or that it might not be, is the fact that it did not appear, at least from the camera angle that I saw, that Mr. Hamlin got hit directly on the chest. Because it would take a pretty direct hit with enough force on the chest in order to cause Commotio cordis. Another thing is he was wearing full football pads, which also protect the chest and the breast region. And even when in paramedic school, when we respond to cases of cardiac arrest on football players, we are told to remove the pads so that we can do effective CPR, because the pads prevent us from being able to compress the heart during CPR. So if that's the case, I would think that'd be a little bit difficult and unlikely for a strike to cause Commotio cordis on a football player wearing full pads. However, as I said, it's possible. The fact that he went unconscious a matter of seconds after the incident, after the hit, makes one consider it. Also the fact, when he hit the ground, went into cardiac arrest, the first responders came out there, they did CPR, and they put the AED on him. It advised a shock. So,
shock advised.
How that works is cardiac monitor. So mind you, this system is a lot more sophisticated than what they were using. So this is a manual and an automated defibrillator. So this shows the heart rhythm here. We'll show different vitals, the end-tidal CO2, the SpO2, the blood pressure, all those things. We're not going to get into those right now. But in a manual defibrillator, you actually would see the heart rhythm show up of the patient, and then a person who understands how cardiology works, i.e. a paramedic, a doctor, whatever, would decide if they wanted to shock the rhythm, with how much energy, how they want to shock it, all that kind of stuff. They see it, they interpret the rhythm, and they shock it. An AED, which is what they had at the football game, is basically a computerized version, which this has an AED mode, which it analyzes the rhythm for them, determines whether or not it's a shockable rhythm, and then advises to deliver a shock based on what it analyzes. And generally speaking, a AED will only advise a shock if it's a ventricular rhythm. So we're talking about something that originates from the bottom of the heart, so VTAC, VFib in general. So, if you went to Commotio cordis, it would acknowledge a shock. It would say shock advised, which it did. He did get shocked out in the field. So that is a possibility. There's likelihoods and unlikelihoods to that situation. Once again, I don't know what happened. I'm just presenting all the possibilities. Another possibility, and this one is actually the most common reason why young, healthy athletes go into cardiac arrest while they're playing basketball or playing whatever sport they're doing. Whenever you hear stories about a guy dribbling down the court in a basketball game and then just falling dead, or someone running track, doing a 100-yard dash, and they fall dead, it's generally due to dilated cardiomyopathy. So, that's a big word. I'm going to break it down for you. What dilated cardiomyopathy is, it is enlargement and weakening of the heart. So, your ventricles, the bottom of your heart, that's supposed to be nice, thick, and strong because it's used to pumping blood throughout your entire body. What happens to those in dilated cardiomyopathy is they get thin and they get weak. How it was described for us in paramedic school was if you take a rubber band, right? You stretch it out, it snaps back shut with force. It's kind of like your heart. When it gets filled with blood, it stretches out, and then the muscle contracts, snaps back, ejects out the blood forcefully. However, with the rubber band, if you stretch it out too much, then it loses elasticity, and it becomes floppy and weak and not as contractile. Same thing can happen with your heart. In dilated cardiomyopathy, the heart is enlarged, it is stretched out, and the ventricles become thin, and they're no longer able to pump blood like they normally should. So, oftentimes patients with cardiomyopathy will be fine throughout their life because they don't need a whole lot of cardiac output to do day-to-day activities. But it's when they exert themselves too much, when they have an increased cardiac demand, where their cardiac output need increases more than their heart can actually handle, i.e. when they're running track, when they're playing basketball, when they're doing wrestling, when they're doing any kind of physical exertion, then the heart is not able to keep up with the amount of demand and the heart stops and they go into cardiac arrest. That happens decently frequently. I can think of a couple calls that I've actually gone on as a paramedic and seen that happen. It's a very unfortunate event, and that's one of those situations where you work your butt off to get this 17-year-old kid back so that his family can still have their son. And it can be pretty unexpected. So, different causes for cardiomyopathy. Generally, when you're talking about young, healthy athletes that don't really have any kind of cardiac history, it's a congenital abnormality. Congenital means you're born with it. So oftentimes in the fetal phase, when a child is being developed, as an embryo, the heart doesn't form fully correctly, or different parts that are in the fetal heart that should not be in an adult heart don't actually go away. So, like, for example, there might be holes in the heart. If it's in the atria, the top of the heart, it's called an atrial septal defect. If it's in the bottom of the heart, it's a ventricular septal defect. Sometimes those don't close all the way. Sometimes heart valves don't fully develop. Sometimes the muscles, the myocardium, which is actually the muscle that pumps your heart, doesn't fully develop. Different things that can lead to dilated cardiomyopathy, and it's usually not seen if it's not super severe until, the patient reaches a point of maximal exertion and they go into cardiac arrest. It's really sad. Another thing that can cause it, remember we were talking about the 20 years of Newports and bacon and terrible life decisions. Yeah, so if you have an MI, myocardial infarction, a heart attack, where parts of your heart are actually getting starved of oxygen and nutrients because of that blockage in the coronary artery, then those parts of the heart muscles that would normally be fed by the blood can end up dying. So then when that blockage is corrected, there's still damage to the heart there. And like what happens with heart muscle is what you're born with is what you die with. So your body doesn't actually produce more heart muscle to make up for the injury. So it just replaces that segment with scar tissue. And the scar tissue from that dead, infarcted part of the heart that has been killed off by oxygen starvation, that scar tissue cannot contract like muscle until the heart gets floppy and weak, and that can cause cardiomyopathy or heart failure. What can also happen is hypertension or high blood pressure over a long period of time. You have very pressurized blood going into the heart, stretching out the heart over a long period of time. You think of the rubber band, it can't snap back as easily. That could be a reason. And then a very controversial reason that I might get in trouble for talking about, but it's realistic, it's in the news, it's happening right now. Over the past 2 or 3 years, there has been a certain intervention that we have all been encouraged, urged, sometimes forcefully to get. And this certain injection has been shown to cause cardiomyopathy in young, healthy people under the age of 30. There's actually a British study that shows this happening very prominently, causing cardiomyopathy in young people. Also pericarditis, which is a swelling in the layer around your heart. Increased pressurization of the layer around your heart. And that can also cause cardiac arrest. And I know the NFL is requiring people to get this certain injection. I'm not saying that that's what happened. I'm just talking about possibilities here. I'm going to leave that alone. Okay? I think you guys got the point. Now, what makes the idea of dilated cardiomyopathy being the reason for Mr. Hamlin's cardiac arrest possible is, as I said, it is the most common reason why young, healthy athletes go into cardiac arrest. It is not uncommon or unheard of for this to happen. Okay? It is pretty common. Now, what makes me doubt, what makes me kind of consider, hey, this may not be the case, is the fact that this gentleman has had no prior history of cardiac issues. He's had no prior history of heart issues with exertion. Mind you, he's a professional athlete. I guarantee, since he's been playing, since high school, since middle school, since maybe Pop Warner days, he trains and produces maximal effort in his training every single day. This man is a physical specimen. If he was going to have an issue, I figure it would have happened before. This man hits his limits every day. This man's average day of practice is going beyond the physical limits of most people. And it hasn't happened before. That makes it a little bit more unlikely that this is a cardiomyopathy issue. Once again, I don't know everything, just considering the possibilities. Another thing is the NFL has a very, very stringent physical examination process. They want their athletes in the tip-top shape and to be as healthy as possible so that things like this don't happen. I guarantee these athletes have all got EKGs, have all got echocardiograms, get regular checkups to make sure they're in the best position possible to play so that issues like this don't happen. And none of these things were actually seen. None of these things were seen prior to this incident in Mr. Hamlin. So I really kind of question whether or not it could be cardiomyopathy. Last thing is, as I said, dilated cardiomyopathy causing cardiac arrest normally happens at the point of maximal exertion. Mr. Hamlin, for all practical purposes, was at rest when he went into cardiac arrest. He got hit, he went to the ground, the tackle happened, and then he stood up. And then he went into cardiac arrest. It didn't happen when he was mid-sprint. It didn't happen as he was making a tackle. It didn't happen as he was running. It happened as, he was on the ground and stood back up. Minimal effort and went into cardiac arrest. That's typically not what you see for dilated cardiomyopathy. Anything's possible. One thing I learned about medicine is that it's full of anomalies. Freak stuff always happens, and the rules and textbooks can frequently be bent. But we analyze general patterns and make our diagnoses and differential diagnoses based off of the patterns that we've seen in the past. And according to this pattern, cardiomyopathy is questionable. So, third possibility. This one is also very, very questionable. It's possible. It does happen. But a lot of things have to align up perfectly for this to happen. Third possibility of things that could cause a cardiac arrest during a football game in a young, healthy person after they've been hit is a high cervical spine injury. So, what your cervical spine is, it's the top 7 vertebra, the top 7 spinal bones in your neck. They go from your brainstem down to about your collarbone level, right? These contain some very important nerves. So essentially, these round bones that make up your spinal column, in the middle of them there's a hole. Through that hole goes the spinal cord, which is a bundle of nerves that basically innervate most of the nerves and most of the muscles in your body. So the spinal cord, bundle of nerves coming down from your brain, goes all the way down your back. Your muscles are controlled through the spinal cord. Nerves come out to your hands, to your feet, to different parts of your body. The reason I can reach and touch this monitor and feel that it's hard is because when I grab this, sensory nerves in my hand travel up the spinal nerve, back to the spinal column, back to my brain, and tell my brain this is hard. Whenever when I move my hand, my brain says, hey, send the signal to move down your spinal cord, out through the spinal nerves, down through the peripheral nerves, to the motor nerves, and cause muscle contractions. That's how that works. So, in the top 5, one of your cervical vertebrae, in that part of the spinal cord, the nerves that control the respiratory drive, so your ability to breathe, that control your respiratory muscles that in your diaphragm, are there. So if you have a high cervical spine injury, you can have respiratory arrest. In paramedic school, they teach you 1 to 5 stay alive, because if you break the vertebra at C1 through C5, cervical spine 1 through cervical spine bone 5, you can possibly have a respiratory arrest and lead to cardiac arrest. Another thing is, if you get hit hard enough, the whiplash effect can even shear on your brainstem. So the brainstem is the very bottom of your brain, right before the spinal cord exits. And there's a part of your brainstem called the medulla oblongata. And that part of your brain actually controls your heart rate, your blood pressure, and your respirations. So, it is possible that during the impact, though it didn't look like he sustained a direct hit to his neck, just the whiplash effect could cause shearing of the spinal cord at the cervical spine level and possibly even tug on the brainstem. And that could cause a cardiac arrest. That could cause his heart rate to drop out, his heart to stop, and then he falls over, goes unconscious, and needs CPR. Things that make me consider that this is not the case is that immediately after he was hit, he wasn't paralyzed, he didn't go into respiratory arrest. Now, it is possible that he got hit, the bones were broken in his neck, they weren't displaced to the point where he's impinging on the spinal cord, but when he stood up and moved, it shifted, and then those bones pressed on some of those valuable nerve structures, and that caused the effect. It's a lot of stars that have to align perfectly for that to happen. I think this is a really unlikely cause of cardiac arrest. But, I mean, it could happen with the whiplash, hit hard enough, doesn't have to even be hit in the neck. Just hit somewhere else, and it causes your neck to jerk in response. It could technically happen. However, things that make it unlikely, as I said, is the fact that it was an immediate paralysis, and also, it would have to be some major, severe shearing forces that cause brainstem tugging, brainstem shearing force. Normally you see this in like head-on collisions with whiplash. You see this in like long falls. You see it in someone like hit in the head with a baseball bat. Really catastrophic things like that. Mind you, I know these athletes are huge, coming at you with a lot of momentum, but, I mean, I would not think, I have not seen personally where an event like that with an indirect hit caused this level of damage. I have seen plenty of people with broken necks and going into respiratory arrest from issues like that, car accidents. But, I mean, it just, stars have to align perfectly. I'm not saying it couldn't happen. It absolutely could. Another thing in order for someone to go into cardiac arrest from a isolated cervical spine injury, which is the most likely result of getting a cervical neck injury, the cardiac arrest would be a result of the respiratory arrest. So in other words, when you stop breathing, after 4 to 6 minutes without oxygen, then your heart will stop. We saw he got hit, and it was a matter of seconds afterwards that he went into cardiac arrest. If this was an isolated cervical spine injury without brainstem, which is the most likely injury in someone who gets a cervical spine injury, then normally if they go into cardiac arrest, it's after minutes and it's from not breathing. And that wasn't the case here. Mind you, as I said, it could be hard enough where it actually tugs the brainstem too, but it has to be just right for that to happen. Also, if there was the freak injury to the medulla oblongata, normally what happens with that is you see bradycardia and hypotension. What bradycardia is basically when your heart is beating too slow. Just brady means slow, cardia means heart. So slow heart. So what happens with this, what happens in a medulla oblongata injury that causes bradycardia, so this part of your brainstem involuntarily sends signals to your heart that tells it to beat and tells it to adjust the rate of beating to your physical activity. Really simple. So when that is gone, your heart has a fail-safe mechanism where the bottom of your heart itself will go into what's called a ventricular escape rhythm, where the bottom of your heart will beat like 15 to 20 times a minute. That's not ideal because your normal heart rate should be about 60 to 100 times a minute. And your body will not be able to sustain this for long with this low heart rate. Your blood pressure will drop, and then you could go into cardiac arrest from that. But with the bradycardic escape rhythm, you would not see a shock advisory on an AED, which makes me consider that probably wasn't the case. Now, there is the theoretical case. That, he got hit, it was a brainstem injury, he went to the ventricular escape rhythm, and his heart got irritated, and that ventricular escape rhythm got faster and turned into VTAC, which then would be a shock-advised warning on the AED, but it is unlikely. I mean, as I said, a lot of things have to align for that to happen. The fourth possible way that someone playing football who's young and healthy could go into cardiac arrest would be due to electrolyte imbalance. And this is probably the most hypothetical, unlikely case that's theoretically possible but doesn't in practice happen a whole lot, but it is possible. So I'll explain that to you. Your body is full of electrolytes, right? Inside of your cells, on the outside of your cells, electrolytes are important for your muscles, for your brain, for the transport channels in your cells to work properly. And the balance and concentration of these electrolytes on the inside and the outside of your cell must be maintained at a pretty stable range, or else problems can happen, right? Your muscles and your heart as a muscle functions off of the proper concentrations of electrolytes. Electrolytes are like calcium, magnesium, sodium, potassium, chloride, phosphorus. All these different things are electrolytes that your body needs. So, when you sweat, right? If you've ever been on a hot summer day or been exercising and you're sweating on your face and it goes into your mouth, it tastes salty. And that's because it's a high concentration of electrolytes within your sweat. Theoretically, if a person is exerting themselves with a lot of physical activity and they're sweating a bunch, they can lose a lot of electrolytes through their sweat. And if they're not replacing them with something like Gatorade, Powerade, Pedialyte, and they're just drinking water, which has no electrolytes, they can be actually diluting the electrolytes they have left, causing their electrolytes to drop low enough and causing cardiac arrhythmias. Normally, the electrolyte most responsible for causing cardiac abnormalities when it's thrown off is potassium. So a condition called hypokalemia is when you have too low potassium in your body, in the extracellular space of your body. So the fluid outside of your cells, when you have too low potassium, that's called hypokalemia. And mind you, your heart muscles need proper levels of electrolytes in order to function. We'll just keep that general concept in mind. So if you sweat off all of this potassium and you're diluting it even more with water, theoretically, when your potassium or magnesium levels decrease enough, you can go into a rhythm called torsades de pointes. It is a rare cardiac rhythm, but it is lethal and it is scary. So what torsades de pointes looks like is basically, it looks like VTAC twisting on itself. And that's caused by either too low magnesium or too low potassium, which they go hand in hand because potassium kind of follows the gradient of magnesium. But when you see this can quickly lead to cardiac arrest. Very rarely do patients have a long period of having a pulse, if at all, when they're in torsades de pointes. And torsades de pointes is a French word for twisting upon a point, which is why you see the twisted VTAC. So, this is unlikely, though, because torsades de pointes, A, is rare to start with, and B, you only really ever see this in, like, renal failure patients who are on dialysis. So, patients who can no longer keep their electrolytes in check by their kidneys, and they need dialysis, and when they get dialysis, tons of electrolytes are taken away and not replaced. These patients sometimes go into torsades de pointes, or if a patient is, has a crush injury or something, or, where their muscles are broken and everything, and lots of different electrolytes spill out of their muscle cells, or even, if a patient is in the hospital for DK, diabetic ketoacidosis, their blood sugar is super high. Because their blood sugar is super high, and their body becomes acidic, their body wants to pee off all this extra blood sugar, and they, along with it, pee off a lot of their electrolytes, so their potassium is already low, and so when they get insulin in the hospital, in order to drive their blood sugar down, their potassium also gets driven down by the insulin, and they go into torsades. It's still rare, but it can happen. So it happening from sweating is very unlikely. It's theoretically possible, but not super likely. Another possible thing that could happen with electrolytes that could cause cardiac arrest in the case of football is massive muscle breakdown. So from overexertion, from running, from working too hard, your muscle cells have a lot of potassium on the inside of them because the intracellular concentration of potassium should be high, and the extracellular, or outside the cell, concentration of potassium should be relatively low. Now, when your muscles are overexerted and they break down, they can spill out the potassium into the extracellular space and cause heart issues. All the extra potassium spilled out into the extracellular space can actually widen out your QRS, cause your ventricles to fire more than they should, and present almost like a VTAC that can go into cardiac arrest. And the monitor would say shock advised because it looks like a VTAC. It's theoretically possible. However, it is unlikely because you normally only see this muscle breakdown called rhabdomyolysis. That's the name of this muscle breakdown causing the hyperkalemia or too high potassium. You normally only see rhabdomyolysis in like crush injuries where someone gets into a car accident and they have the engine block sitting on top of their lap and it's on them for like 2 hours as fire's trying to cut them out of this crumpled car, and then when they take off the big heavy engine block, their leg muscles that have been crushed, the pressure is now released and all that potassium dumps to the bloodstream, they go into cardiac arrest and they die. Or in like an electrocution, someone gets struck by lightning. Remember, as I said, your muscles contract based on electrical conduction. So when you get struck by lightning or electrocuted, the reason why you shake is because your muscles are clenching up. They're clenching up so forcefully that muscles can actually rupture, dump potassium into your bloodstream, and then you go into rhabdomyolysis and cardiac arrest. Also, a situation that sometimes happens is, you hear about meth man or guys on bath salts or Flocka or all these other crazy drugs that you have to be insane to take. When those people are just running through the streets, butt naked, flipping over cars, just acting a complete fool, rage man, strongest 10 men, and then they just die, that's often due to rhabdomyolysis because their body is no longer responding to the pain response that says, hey, stop trying to flip over that car. Like you and I would have. If we tried to flip over a car, it would hurt, and our bodies would say stop. But they don't feel that, so they just do it anyway. They overexert their muscles, they rupture, potassium releases, they go into cardiac arrest, they die, right? This is unlikely for Mr. Demar Hamlin because he was a top-grade athlete. I mean, this man trains every day. He pushes his muscles to the max. His muscles are well-conditioned to handle the stress that he puts them under when he plays football. That's the whole reason why he trains so much, just so his muscle and his body would be conditioned to handle the stress. So I wouldn't think that the stress from playing football would be anything that would push him over the edge to the point of rhabdomyolysis because he trains for this all the time. Right? This is what he does every single day. His muscles should be well conditioned. So I don't think that this is really the reason why that would happen. However, it's possible. I hope this episode was informative to you. I hope it helped dispel some of the confusion about what cardiac arrest is. And I hope it helped to shed some light as to the possible causes of cardiac arrest for a young, healthy football player like Demar Hamlin. Once again, here at the MD Medic Podcast, we are all supporting his family. We're all praying for his family. We are wishing a speedy recovery to both him and to the team and to the family. All of our love and support is going your way. We wish nothing but the best. I hope that this episode was helpful for you guys. Please like, subscribe, follow us on YouTube, Spotify, Instagram, Twitter, all the above. Prayers for Demar. MD Medic Podcast out.